Good afternoon. It is afternoon, everyone. This is the Public Health and Minority Health Disparities Subcommittee. It is 12:20, and I want to make sure that you all get at least a little break. We have a lot of bills today, so and we are now a week from, or I guess a week from crossover, 2 weeks from crossover, 2 weeks from crossover. I keep making myself nervous. So we're gonna start meeting multiple times during the week. So we'll see how much of this we can get through, and then we'll figure out our next meeting. I'm going to jump around a little bit just because right now I have a lot of stakeholders for House Bill 386. That's the pesticides, PFAS, chemicals prohibitions. I understand we don't have consensus yet, so if I could just get a quick update, because I know that we are zeroing in. And Delegate Hutchinson, if you can take point on this, and then any of the stakeholders who want to be heard, and then we will talk about our other bills.
Sure. So we've have had multiple meetings now at this point between both parties. We've gone back and forth in terms of the definition, the timing, the waivers. We have not come to a consensus yet. We feel like we're getting close. And we had a meeting this morning at 8 a.m. that lasted an hour. And some more homework assignments have been divvied out, and we will meet again on Monday at 6 p.m. Next week.
Thank you very much. Is there anyone on this bill that would like to be heard? Because I know a lot of you came to the meeting today, that would like to add anything to the discussion for the sake of the subcommittee. Give it a moment.
Hi, this is
Schmidt-Perkins, did you want to go ahead and speak? Go ahead.
Hi, this is Drew Schmidt-Perkins representing Maryland Pesticide Education Network. Just want to express a quick appreciation for all the work that the subcommittee is putting in on this, and we have our sleeves rolled up and working to find a solution. Thank you.
Great, thank you very much. Anyone else on this bill? All right, thank you so much. We are going to hold that and work towards getting a finished product that our subcommittee can vote on and get out and on the floor. I want to move now to Phenibut, because again, this is one where we're not going to vote it today. We're going to discuss what we're looking to do, and I'm just going to talk through a little bit. Most of us were here last year when we had the tianeptine bill and the kratom bill. What we're looking to do with the Phenibut is amend it to look very similar, if not identical, to kratom, which does not ban it, but it significantly limits it limits how it can be advertised. It limits who can purchase it. And I spoke with Dr. Kalyana Raman during the interim, because this is an ongoing challenge of these unregulated ingredients. We are going to work on potential legislation that could be a little more of a catch-all, so that we're not here year upon year as these new products come on the market. Erin, is there anything I missed on that?
No, we're good. I think you described it well. And I think one of the issues too was about the report. Kratom required MDH to do a report, and there's talk about maybe striking that report and looking at other ways that we could follow and track incidents regarding the different chemicals and medications.
Thank you. In our conversations with the department, one of the challenges with reporting is that this is not a product that's necessarily tested, and we don't have good tracking mechanism. So we really want to focus on the distribution of it. To that end, we also want to make sure that we are sharing our amendments with some of the stakeholders who were not necessarily involved with the initial hearing. And I know that Delegate Bandari also has an amendment which we will be adopting in subcommittee once we have the language to name it after the young man who passed away. Delegate Bandari, did you want to say anything else on this bill?
No, I'm good.
All right, thank you very much. Again, we're going to hold that bill just so we have a little more time to make sure that we've contacted all of these stakeholders. I now want to turn to House Bill 930. This is the Public Health Abortion Grant Program Establishment. Erin, if you can talk us through the bill, and I don't remember if that one had amendments.
There's one amendment. There is a reprint.
Yes,
I mean,
that's
the
right.
amendment's very simple, but I just
Technical,
provided
okay.
a reprint anyway. The
But-
bill establishes the Public Health Abortion Grant Program and the Public Health Abortion Grant Fund in MDH to provide grants to improve access to abortion care clinical services. Excess funds in carriers' segregated accounts for abortion care clinical services under the Federal Patient Protection and Affordable Care Act must be used to support improving access to abortion care clinical services. By September 1st, 2025, and by July 1st, 2026, and annually thereafter, the insurance commissioner must order the transfer of specified funds from these accounts to the new special fund. By October 21st, by October 1st, 2025, the governor must allocate by budget amendment $2 million of the funds for the program. And then beginning in fiscal 2027, the governor must include in the annual budget bill an appropriation for the fund of at least 90% of the ending balance of the segregated accounts that exceeds disbursements after the 15-month period following the end of the plan year. There is an amendment within the reprint. If you look on page 4 of the reprint, it is a date change. The bill as introduced required the amount transferred of interest that's accrued in the segregated account to transfer as of December 1st, 2025. And this amendment clarifies that it would be December 31st, 2024.
Thank you, Erin. And as you recall, we just had the hearing on this bill. This is a fee that was established under the Affordable Care Act. Is there anyone who wants to be heard on this bill before I ask for a motion on the amendment? Do I have a motion on the amendment?
So moved.
Second.
All right, it's been moved and seconded. Any further discussion on the amendment? Delegate Chisholm. Nope.
Yeah, there he is.
Delegate Chisholm, you seem to be frozen. There
I'm
you
sorry. I lowered my hand. I'll wait till you adopt the amendment and then I'll
Okay.
ask questions on the bill as amended.
All right. Thank you so
Thank
much.
you.
All right, so we are on the amendment. All in favor say aye. Anyone opposed on the amendment? Go ahead and raise your hand. All right, on the bill as amended, do I have a motion?
So moved.
Do I have a second?
Second.
All right, it's been moved and seconded. All right, and now we'll open it up for discussion. Delegate Chisholm.
So Governor Moore announced 15.6 million to improve abortion care access. That was for 2025, including 5 million allocated increased Medicaid provider reimbursement. Additionally, a $10.6 million grant was awarded to University of Maryland, Baltimore. Is this on top of all of that?
Delegate Lopez, I saw you unmuted.
Sure. Thank you, Chair Bagnall. Yes, it is, but these are not taxpayer funds. This is a surplus of insurance premiums. So this isn't a state funded.
So it's on top of whatever insurance is already paying into abortions.
Well, right now, there's only 2 ways that our state pays for abortion in one way or another. One is Medicaid, which these funds are not to supplant, right? That's a completely different program. And then there's also the training program, which we passed year before last, and that's 3.5 million to train folks to be abortion providers. So those are the 2 places where it's in our budget.
So I'll have to figure out the total that the taxpayers are now on the hook, plus insurance companies. And I mean, insurance companies are insurance companies, but it's still Maryland citizens for total for abortion care, because it seems like we just keep adding more and more money, and I don't understand.
So this is, just to be clear, this is something that people who have been purchasing their health insurance through the state exchanges have been paying for 15 years. There's no new charges here. We're basically taking an account that has been paid into through ratepayers for the past 15 years and using it for the purpose that the federal government told us that we need to use it for.
And now, because the federal government has changed course, you feel like we need a grant. Am I understanding correctly? I'm not for the bill, obviously, but I just want to make sure I
Yeah,
understand.
I wouldn't say it's wholly in part of what the federal government, like with the Dobbs decision, turning it to the states. I think that's part of it, but a large part is just because our abortion providers they're running into financial trouble trying to keep up with the demand.
Well, that's
And Delegate Chisholm, I think,
so
I
more
think
money
this-
is going to help with the demand.
No, there's going to be able to keep the doors open so they can provide these services.
And Delegate Chisholm, I think our vice chair had some additional context as well.
Okay, great.
Thank you, Madam Chair, and thank you, Delegate Chisholm, for the questions. But I just want to just be really clear, and I think the bill sponsor has been clear about this. This is money that that is sitting in a bank account that every person who buys insurance on the commercial market has been paying $1 per member per month for 15 years because of an amendment to the ACA. And as a result of that, and insurance, that money was to be used by the carriers only to provide abortion services. Now, my friends on insurance and pharmaceuticals know that anytime we do a new mandate, we have a study that says how much it will cost each member per month. And it usually averages somewhere between 5 cents and 14 cents per month for the different things that we've mandated. For whatever reason, whoever made the amendment to the ACA decided $1 per month per member should be put away for just this reason. So the money has just collected. It can't be spent on anything else. And I mean, by federal law, it cannot be spent by anything else or for anything else. And it's collecting interest. So what this bill will do is make sure that that money is used for the purposes it was intended. And so it's not adding cost at all. It's what people are currently paying and have been paying for 15 years in insurance premiums, not in taxes, but insurance premiums. That's where this fund is coming from.
So when I see, special fund increases of 19.3 million, that's money that's sitting somewhere now and it is just going to be shifted. It's a
Right.
It's a shift.
As
It's a
I understand it, and correct me if I'm wrong, Madam Vice Chair or the sponsor, this is basically taking an existing segregated fund that is segregated by the insurers and putting it into a segregated fund to provide abortion care services. But it's still utilizing it as it was intended and as the federal government has told us that this is the only way we can actually utilize the funding.
So
and it's sitting with insurance carriers.
Right.
It's not
It's currently-
sitting in
it's
the
currently
government
sitting with-
anywhere. It's
Yeah,
sitting with
it's sitting with
carriers.
insurance carriers.
so the insurance carriers have just been sitting on this money for 15 years, kind of locked
Yes.
Correct.
Under federal law.
under.
They were forced to do this. This is not what insurance carriers would have wanted to do, but they were told to do by an amendment to the Affordable Care Act.
Back in 2008 or whenever it was. Okay.
Yeah.
All right. Thank you for the clarification.
Oh,
Thank you,
you're most
Delegate.
welcome.
Delegate Rosenberg.
Would this fund be used only for Maryland residents? Or would it be used for the people who are coming in addition? Could it also be used for people who coming here from states where an abortion, they cannot obtain an abortion under their state's law, and therefore they're coming here. Is this restricted or not restricted?
And who's best to answer that? Delegate Lopez, go ahead.
Sure. Delegate Rosenberg, there's no conditions on residency or insurance. So you don't have to be a Maryland resident to use this grant program. And you don't have to have any specific type of insurance. You can be totally insured and just not want an explanation of benefits to be mailed to your home. You could be underinsured, where your insurance might cover a portion of things, or you could be completely uninsured. It is expressly written in the law that there are no restrictions in those ways.
And just to be clear, we don't have residency requirements in other healthcare policy. Is that correct?
That is correct. That when you go to the emergency room, they might ask for information in terms of your insurance and things like that, but they don't ask for residency requirements. And there's no prioritization of what type of care you receive based on your residency. So that's not a precedence we want to embark upon now.
Thank you. Delegate Riley.
Thank you, Madam Chair. Have we checked into to see if the state could actually access these funds and put it towards the abortion training centers? Because it's basically that's what that money is for, which is like, $3 billion. So why can't the state access those funds? Because it's actually doing the same thing. Have we asked that question?
And Delegate Lopez, are you best to answer this?
Sure. Yeah,
or
absolutely.
Chair?
So in federal law, it expressly says that these funds can only go for abortion care services. And services is defined as the procedure and then the administrative work that goes along with the procedure. And so it can't cover travel, it can't cover lodging. These funds cannot cover, any of the auxiliary expenses that might go with having a medical procedure. They're very restricted in what they can do. It's only for the services. So
I actually think that that's exactly what our abortion training centers are doing. We are actually training people to perform these services, which we do not have enough of, you said. So I would think that we could make a good case for that.
And
Especially with the state that the budget strengths that we're in, this certainly would help.
And Delegate Riley, I think we might have an answer from Robin Elliott.
Okay, thank you.
Certainly.
Good afternoon. Just to expand upon Delegate Lopez's observation, the federal law is indeed quite narrow and specifies that it must be spent on the services themselves. We worked with, on behalf of the Women's Law Center of Maryland, we worked with the National Health Law Program over the summer, as well as the National Women's Law Center, because there are certainly other needs in the reproductive health landscape. And I think you're raising a couple of those questions. And the legal analysis from every source said this had to be spent on clinical services itself. So there isn't any sort of room to go beyond that. So that's why the bill is structured so narrowly. And I should say it's not just abortion services themselves. It is abortion services for which federal funds cannot be used. There's a very narrow number of abortions by which the federal government will pay for them under the Hyde Amendment. And the monies being contemplated in this bill can't be used for anything that the federal government will pay for, but all the other abortions, which are the majority of abortions. So it's very specific to services.
So it's very narrowly tailored per federal law. Is that correct?
Yes, that is correct.
All right. Thank you very much. Are there, I believe we're on the bill as amended. Are there any further questions, any further discussion? Seeing none, all in favor on House Bill 930 as amended, please raise your hand, say aye. Anyone opposed, go ahead and raise your hand. So I record accordingly. I have Delegate Chisholm, Delegate Riley, Delegate Hutchinson, is that, okay, I got you.
That was a no.
I got you. So I've got Delegate Hutchinson, Delegate Riley, Delegate Chisholm, opposed to the bill. Thank you very much, everyone. Thank you for a very respectful and robust discussion. I am aware of the time. I would like to go 5 more minutes and see if we can get a couple more bills. And then we will discuss the next steps. I believe we have a consensus on House Bill 32. This is the Maryland Department of Health Forensic Review Board and Community Forensic Aftercare Program established. We heard this bill January 29th, and the bill sponsor has been working with the department. Oh, I see a hand already from the Behavioral Health Administration. All right, let me turn to Aaron. We'll talk through the bill, and then Secretary Lord, if you can fill us in on where we are.
The bill as introduced would have required the Department of Health to establish a forensic review board at each facility that has persons committed as not criminally responsible. The boards are responsible for reviewing and determining whether to recommend to the court that a committed person is eligible for discharge or conditional release with or without proposed conditions. The bill as introduced also codified the Community Forensic Aftercare Program within MDH to monitor persons committed as not criminally responsible who are on conditional release, and specified new requirements for the program. You do have a reprint of the bill. It was my understanding that this was worked out with MDH, state's attorneys, and public defenders. These are sponsored by the bill sponsor, who is Delegate Charkoudian. If you look on bill page 2 of the reprint, it defines authorized agent as an individual who is not counsel for the committed person and who is selected by the committed person to represent the interests of the committed person in all forensic review board matters. And the bill, as introduced, required the Department of Health to establish a forensic review board at each facility that has charge of a committed person. The amendments would require the forensic review board to make, it authorizes the forensic review board to make recommendations related to the release or rehabilitation of a committed person. The amendments also provide that at least once each year, each forensic review board would review each committed person's eligibility for release. The bill as introduced required the forensic review boards to, by a majority vote of their members, determine whether to recommend to the court that a committed person is eligible for discharge or conditional release with or without proposed conditions. There are amendments added at the bottom of page 2 that provide that when making a recommendation, a forensic review board must consider a written statement offered by the committed person to the forensic review board that they are required to provide notice to a committed person and the counsel of record for the committed person at least 10 days before the board holds a meeting concerning the committed person and within 10 days after the review board issues a recommendation to the court. There are additional amendments on bill page 3 that provide that a committed person may appoint an authorized agent to attend the portion of the forensic review board meeting concerning the committed person, that the authorized agent may be a social worker or an investigator employed by the office of the attorney representing the committed person, that the authorized agent may only give and hear arguments, and that counsel for any party may not attend forensic review board meetings. The bill is introduced provided that if the committed person's treatment team determines that the committed person is eligible for discharge or conditional release before the annual review, that the treatment team shall notify the forensic review board in writing of the need for a release eligibility review. There are additional amendments at the bottom of bill page 3 that provide that the committed person's treatment team must implement recommendations, if any, from their forensic review board and make arrangements for the necessary treatment to rehabilitate the committed person, and that a forensic review board may appoint a representative to testify as to the health department's position at a release hearing. Furthermore, if a forensic review board takes a position contrary to the position of the committed person's treatment team, the representative appointed may not be a member of the committed person's treatment team. There are amendments that provide that MDH must adopt regulations to carry out this part of the bill. And then the second part of the bill, as introduced, that would have required community forensic aftercare program, is all stricken by the amendments.
Thank you, Aaron. Delegate Charkoudian and Secretary Lord, where are we? Do we have consensus?
It was my understanding that we did, so I'm about to find out maybe if there's something new that's come up since we reached consensus.
Well, first and foremost, I want to thank Delegate Charkoudian for all of her leadership and support and bringing the various parties together. We are like 99.9% there. There's only one thing that we want to flag, which we had flagged previously, which is under the authorized agent. It's the language of the investigator. These meetings are clinical in nature. Social worker, we are in complete support of that language. It's just the language related to the investigator in the office of the attorney. That role is a non-clinical role, at least that's our understanding, within the office of the attorney representing the committed person. So that was the only thing that we were hoping that we would potentially be able to revisit. But again, I really want to thank Delegate Charkoudian for all the work that we've been able to do on this legislation.
And I have a hand from Delegate Chisholm.
Thank you, Madam Chair. After the amendments that we just heard and removing the aftercare, does that affect the fiscal note dramatically? Does anybody know? It's a big fiscal note, but I don't know how much of that is aftercare.
Delegate Charkoudian?
What I had been told by the department is that does remove it, but I'm not, I don't speak for them, but that was what I was told. It was part of why I agreed to remove that.
Okay.
And Secretary Lord, I see you nodding your head. So
Sorry, I'm nodding on mute. So yes, that will impact the fiscal note.
All right, and thank you. I see Delegate Hill.
Thank you. So following up on Secretary Lord's request, Delegate Charkoudian, is it something specific about investigator? Can it be an employee or a designated employee of the attorney representing the person? Is there some language that you're comfortable with, or is investigator key for you?
I would be fine, and especially if you could do it by voice vote, like if it said social worker or other designated employee. I think the idea was that a lot of these people have no one in their lives, so they can't get a parent or find a friend to show up. And so if they have a public defender and we're saying the public defender can't be there, they may or may not have a social worker. So someone from the public defender's office, if that's the only person that exists for them. And so that was sort of the idea, but I would be fine with, we already are banning the attorneys from attending. And so if it said social worker or other employee,
Other designee, baby.
Designee
or something like that, I'd be fine with that language.
Secretary Lord,
Thank
I see you unmuted.
Yes. Thank you, Delegate, for continuing to work with us, and so happy to circle back on the proposed revision.
So
I think
does it-
striking investigator
So
language.
you can't tell us if it's a other designee from the attorney's office? Tell us now, if that's okay.
I think it should be fine. It's just a question of, because these are clinical in nature, we've already agreed that we won't have any attorneys present because the discussion really centers
So it
around
could
the
say
clinical-
non-attorney designee.
Correct.
So let me ask this, because obviously we are going to be voting later in the week. Can we vote on these amendments in concept? Circle back to if there's another word that we need to replace with designee. Can we vote on these in concept? And then if there is a concern, you can
Madam Chair?
yes, go ahead.
If I can just get clarification from Secretary Lord, when you just said we agreed that there and delegation that no attorneys, I'm not it's clinical in nature. Are you having an issue, regardless of whether they're called designee, investigator, that it's someone from the attorney's office, that you don't want legal representation there? Is that what your issue is, or is it the word investigator? So we're clear on what we're talking about.
So the decisions that are made at the Forensic Review Board are clinical. They're not legal in nature. So on both sides, on behalf of the department and on the OPD, there was agreement
that attorneys would not be representing their positions, that this is really around the clinical teams coming together to make a recommendation regarding the clinical next steps for that individual. It has
So if-
nothing necessarily to do with
All right, so if
their
I
legal
may,
standing.
if
Yes.
I may, do you have another solution to Delegate Charkoudian's point is sometimes these people have nobody other than who they have a contact with, the social worker may not be there, but their other contact may only be a legal contact. So it sounds like you're not really arguing about the word of who represents from the attorney's office. Sounds like you're actually taking issue with anybody from an attorney's office being there. And
Well,
if
there-
that's
there
correct,
was-
then I would go ahead. I will move as the chair has asked us to, but I just want to be clear on what the problem is, because I don't think if we don't understand the problem, we're going to come up with a good solution for it between now and voting.
Well, based upon the authorized agent language that has been included, it does to address many of the concerns raised by Delegate Charkoudian, the OPD, that it expands the definition of individuals that may be able to engage. So we're in complete support of that, of having individuals that can help, whether it's a family member, friend, community, pastor, whatever it is, social worker, whomever it is, that come in and speak on behalf of the committed person, and to have their support. The request, again, which was on both sides, which was to not have legal representation in the room because it is a clinical deliberation.
So
in
it
terms of
sounds
the
to me,
Yeah.
I'm sorry to interrupt and talk
No,
over you,
you're good.
but if I may, Madam Chair.
Go ahead.
Okay, it sounds to me that what you're really saying is that you want something that says in a non-legal status. In other words, I might have a family member who's a lawyer and they can be there. You're not saying you can't have lawyers, but you don't want them to be there in a legal status.
Yep.
That's not what they're there for.
Yep. So you read
Delegate
our
Charkoudian, does that make it easier for you to think about what might work?
Sorry, yeah, so the language explicitly says, counsel for any party may not attend. So that's on there. What the public defender's office, the reason they wanted an authorized agent, maybe a social worker or investigator, is because once we said counsel can't attend, they were worried that if the only person they could send is another employee from the office, because the person has no one, that that would somehow be interpreted as counsel because they come from the counsel's office. So that was the reason for the second sentence, beyond counsel may not attend. The second sentence was social worker, investigator, someone who is not counsel could attend, because again, that may be the only person that could be found to be there for the person.
Delegate, would you consider potentially language that would say social worker or other non-legal representative, which I think
From other non-legal representative from the public
office of the
defender's
attorney.
office, that's fine. Yes, that's fine.
I love this. We got there. I was giving you time. I see Aaron smiling, so we have that. All right.
Move the amendments.
Do I have a second?
Second.
All right. Amendments have been moved and seconded. Any further discussion? All in favor, please say aye.
Aye.
Anyone opposed? Go ahead and raise your hand. Do I have, Delegate Chisholm, are you opposed to the amendment? Delegate Riley, are you opposed to the amendment?
I thought we were on the bill. I'm sorry.
That's okay. That's all right. We're going to go ahead and I'm going to ask, move the bill as amended. Do I have a second?
Second.
All right, it's been moved and seconded. Any further discussion? All right, thank you very much. All in favor, say aye.
Aye.
Anyone opposed, go ahead and raise your hand. This is on the bill as amended. So I have Riley, Delegate Hutchinson. Delegate Chisholm, all right, I just wanted to make sure.
Thank you.
Recording everyone accordingly. All right. Thank you, everyone. Thank you for giving me the extra time. I really was trying to get you out earlier, but we were so very close. We have a few more bills that we're going to consider. I'm going to ask you to look at tomorrow morning before floor, and I will update you after I have been able to talk to our leadership. Thank you. I will see you all in just a couple minutes for bill hearings. With that, we are adjourned.